Dr. Lonnie Douglas has been with us before. He's a professor in the UofL School of Medicine and orthopedic surgery and a surgeon himself, and he's seen a lot of injuries and written about some of them, including slap injuries in baseball players. Lonnie, welcome back.
Thanks for having me back, Mark.
What the heck is a slap injury? SLEP. What is that?
Actually, SLAP, like a slap in the face, literally. That's an injury that was first coined by my mentor, James Andrews, and another guy, Snyder, way back in early 70s. And it stands for superior labrum anterior to posterior tear. That's a big mouthful.
Yeah, that is a mouthful. What's that mean?
Essentially, the labrum in the shoulder, just for a little bit of background, is sort of like the meniscus in the knee. It's a ring of gristle that sort of acts like a bumper that goes all the way around that ball in the shoulder, sort of like the bumper on a pool table.
Okay.
Only it was one big ball. Now that bumper helps keep the golf ball on the tee, so to speak. Then your hip, the hip is stable because it's a ball in a socket. And it's mechanically stable.
The shoulder doesn't have that?
No, sir. The shoulder is more like a golf ball on a tee that you turn sideways. Now, to give it the things that keep that golf ball on the tee are all the soft tissues and the muscles and the tendons around the shoulder. And the labrum is one component of that. A slap tear is where the very top of that bumper tears. Now,
so if I'm looking at you, what are we talking about? The top. So it's the top of your shoulder.
Correct. If you feel that bony shelf right over the top of your shoulder, it's directly underneath that.
Okay.
Now, that doesn't make the shoulder dislocate. If you have a labrum tear in the front, you can dislocate out the front. If you have a labrum tear in the back, you can dislocate out the back. This one's up top. So it's a bit of an unusual character, but the thing that makes it unique is your biceps tendon, that causes you to flex your bicep and turn your hand over, attaches to that bumper too. So it gets a bit complicated. There's a lot going on.
Right, there's a lot of stuff going on in your shoulder there.
That's right.
All right. So, and you looked at how this impacts baseball players and whether pitchers have any different outcomes than the other players, right? If they get it at an early age, right?
Correct.
All right, so go ahead and talk about your study and then what you found.
Well, the reason we look at baseball players is that if you can make these injuries work well in someone who needs maximum function and pristine function in their shoulder to perform their job or to play their sport, presumably you could get it pretty good for everybody else too.
Right.
And so that's always been the real reason for looking at baseball players, besides the fact that, being a sports surgeon, that's sort of the
deal.
Orbit.
Yeah.
Yes, sir. There's two different ways you can tear this labrum. Now, for anyone listening, most folks probably aren't throwing baseballs off a mound. But lots of people get these injuries. It can happen two ways. One is the good old-fashioned just banging into something. Something hits. Imagine like knocking that bumper off a pool table with a sledge or pushing the ball off. Another way to do it is in the throwing motion. So when you land on your shoulder, it drives this thing up. It makes the arm hurt. It aches deep down inside, like almost in the middle. It can make the arm feel like it's dead or tired. It can actually make all 5 fingers tingle and give you weird sensations down the hand, almost like your hand's going to sleep. It takes a lot to sort of tease these things out, and lots of people miss it. But the other way that you can injure it is by throwing baseballs, for example. And that's more because of the rotation, the torque. I told you that biceps tendon attached to it.
Right.
Well, that's important because when you throw a baseball, throwing a baseball is not a natural motion.
Right.
We have to teach our bodies to do that. And when you put your arm way back to get ready to let the ball go, when you're cranking up, that tendon is being pulled backwards, like putting your hand behind your head. It pulls that tendon backwards.
Right.
When you come forward and you release and the follow through, that tendon's being pulled forwards. So when you're constantly throwing, it's like pulling a weed back and forth, back and forth, back and forth.
Right.
So eventually it starts to peel this labrum off and creates a tear. Now, some degree of that.
So does this start? Does this start in young kids? Does that happen in kids that are 10, 11 years old and they're pitching in Little League, or does it only start as you get older and you're throwing 90 miles an hour?
That's a terrific question.
Okay.
Because it has to.
It has to what?
It has to happen in order for someone to effectively throw a baseball. So there's a certain amount.
So every 12-year-old kid out there is doing a little bit of tearing every time he's throwing a baseball?
To get their arm way back, to get some real zip on the ball. It's like this. Anybody out there that grew up throwing baseball or throwing rocks, throwing a football, see how far behind your back you can get with your throwing arm And see how far
so like
you can
scratch your back.
to scratch the middle of your back. See how far you can get with your throwing arm. See how far back you can get with your non-throwing arm. You got way more rotation in your throwing arm. So there's a certain element of this that are normal adaptive changes to really get some zip on the ball. So the problem with slap tears in baseball players is it's a natural adaptive mechanism that's gone too far. Right? When those adaptations go too far and the shoulder is now suddenly too loose and it's got the tear it's peeled back too much, that's when it's problematic. And that's what we looked at in baseball players.
Okay. Let me tell you, we're talking to Dr. Lonnie Douglas, who's a professor in the UofL School of Medicine in orthopedic surgery and a surgeon himself. And we're talking about baseball injuries, slap injuries of the shoulder in baseball players. So you look specifically at pitchers versus daily players. Right.
Correct.
All right. So I assume you found that pitchers have more tears and tougher time recovering? I don't know. What'd you find?
You're exactly right. And what we were trying to demonstrate is it's not the most exciting thing in the world to talk about this natural progression of the motion in the shoulder, but it's important. Because if we're able to catch the pitchers, if we're able to catch the position players before it goes too far, before these normal changes become really pathologic, for example, when that tear in the labrum gets so much and the biceps moves so much and the arm gets so far back that it's not really doing its job anymore of protecting the shoulder, all that stress starts getting transferred to the rotator cuff. I mean, we won't get into all the mechanics of that, but the problem starts.
So there's
growing.
a domino effect,
yes,
potentially,
exactly right.
that when you start with these slap injuries, they could affect the rotator cuff and other arm injuries.
It progresses just like dominoes on down the pipe.
So what's the word as a surgeon then to parents like Brad Knoop, who's sitting in here with us, and he's got 3 boys. I think 2 of them were pitchers. What's the word to those parents? Should they be coming to an orthopedic surgeon at age 12 and saying,
"Oh Lord, no,"
and saying, "Hey, you want to look at my kid's shoulder to make sure he's not tearing something"?
No, Mark, I think last time we discussed Tommy John injuries a bit, and that's
did.
something that can affect kids as young as 13, 14. God help us if it was 12. But no, with a slap tear is something more when you start getting into the high school ranks, when you really hit maturity, right?
Okay.
When you stop growing, my advice would be if you're starting to lose some velocity on your pitches, if you're starting to lose some control, if you're starting to feel weird sensations in your hand, down the arm after a long session of throwing, and don't just ice it and walk it off, and get it checked out, because what we found in our study that contradicted and was contrary to what has historically been in the literature is if we catch these before it progresses too far, they can actually do much better than what's historically been reported.
Meaning what? They recover faster, or they regain their velocity on their fastball? What?
It means they can return to whatever position they were playing, including pitching, with a much higher likelihood. And the literature has reported rates of returning to play as low as 30% after having these fixed. That's
really?
Pretty terrible.
So they require surgery if you have a slap tear that is the labrum tear that is just it's pulling away from the bone and all the other stuff in there. Do you have to have surgery, or is it something that can be fixed by just resting your arm for an entire baseball season? That's
another great question, because we try to spare somebody surgery, especially because the odds of success aren't 100%. What we did find is that we can, if you select and the patients correctly, and you catch it early enough. I apologize, I'm going hoarse.
Allergy season.
No kidding. If we catch it early enough, we can make it as successful as 80-90%, even in pitchers.
So what's your pitch for UofL sports medicine and sports orthopedics?
We got some big things happening downtown, Mark. We've got a tremendous new CEO that's breathing an awful lot of life into the system. He's hard charging. He's ambitious. He shares the same goals we've had for University of Louisville sports medicine privately for some time. There's big stuff coming on the horizon. It won't be very long either. So.
All right. But the pitch you're making to parents out there is if you're looking for somebody to take your kids to check out their arms, come see Lonnie Douglas and company. Come
see me downtown at University of Louisville. I'm in the outpatient building. See patients there in our private office. I will guarantee you one thing: we'll get it figured out. We will get it correct.
Okay, and hopefully without surgery.
Correct.
All right. Dr. Lonnie Douglas, always great to see you. Thanks for being on the program.
Thanks, Mark.